welcome you to the webinar on exploring opportunities in the digital health market, and we're extremely grateful to each one of you for being a part of today's event. At the outset, I would like to thank our associate partners, mfine and dozee, for the continued support in making this event a possibility. The BRICS Chamber of Commerce and Industry was founded in 2012 with the efforts of eminent professionals, entrepreneurs, industrialists, bureaucrats from BRICS and beyond, having its headquarters in New Delhi, India, and country offices in Brazil, Russia, China, and South Africa. In nearly a decade-old journey of the Chamber, it has promoted business houses for trade and commerce from all BRICS nations and neighboring countries. The Chamber is empaneled with NITI Aayog and United Nations. Our efforts have been recognized by several Union Ministers of Government of India and governments of BRICS nations. Without further ado, I would now like to invite Mr. Vishwas Tripathi, Chairman, BRICS CCI, to kindly take over and deliver the welcome address.
Yeah, I welcome all the participants, all the eminent speakers, our prominent associate partners, mfine and dozee, to this webinar on exploring opportunities in digital health market. As the name suggests, webinar on exploring opportunities in digital health market. Friends, now this exploring opportunities, we have got so many in the last 1 year. God has given so many opportunities that we have got at present problem of plenty. I hope you will agree, because this is for the first time in the last 1.5 years, the whole world has seen what a miracle digital health market, digital health segment can do. And who knows better than the countries who are not as developed, like underdeveloped or developing countries like India, Asia, Africa, and these continents. This digital health market is robust in Europe, America, Canada, to a large extent. But other part of the world, the digital health market is now the need of the hour. This pandemic has really taught us that we need to connect with each and every person who needs health services across the globe. In India, as we know, let me tell about India. In India, as we know, that 2% of the doctors cater 68% of the population in rural and sub-rural areas. So physically, they cannot go there. So this opportunity is such a great opportunity. And if we explore this and we work on it, and the last 1.5 years, I have seen so many things. Like I tell you my example. I am not that technology savvy, but in this pandemic, doctors are not available to meet one-to-one, as traditionally has been the case in India. So what we have to do? We have to give them, tell them WhatsApp and other things and all these things. So these are the things that I'm learning. I have learned in the last 1 year. So, and this huge strata of the society, not only India, in other BRICS nations and beyond, we need to find opportunities. We need to select opportunities that can help everybody in this sector. Like, you have got AI now, artificial intelligence. You've got mobile health services, which is so much in the vogue. And we at BRICS have taken this in our main mission to equip companies from India and across BRICS nations and beyond BRICS nations to come together on a platform. It is an NGO, non-profit organization, come to here to a platform where we can address the issues of the companies to companies. We can make them aligned as collaboration and other things. We can speak to the governments of the day, whether BRICS countries or beyond countries, friendly countries, so that we are a chamber of BRICS commerce and industry. So in this health sector, we would like that all these companies come on this platform to the best possible manner and we want to integrate them among the companies so that they can benefit among each other, and in the larger interest, public is benefited ultimately, and governments of the day also will be benefited. So, friends, we have now decided in BRICS to create a vertical on this digital health market. And I would request all my participants, all my speakers, all the companies, all the participants who have joined, that you please join this platform, and we'll create a vertical where we can take your voice to the people who need to listen it, to the companies with whom you are interacting. My phone number is there. My details are there. So then you can share with the people. I'll be more than willing to share all the information, all the deliverables that I can give through chamber to them. So I wish great success to this session, and I'm sure that I have seen the list of the participants and the speakers. I'm sure it is going to be a great session which is going to benefit each participant, each interest groups, whether it is government, whether it's private sector, whether it is NGO sector, whether it is any sector. And we all have to strive, we all are striving to help the public at large, because we have seen in this pandemic how difficult it is to serve the people. We have the deliverables at our end, but logistics are not there. Logistics are the problem. This is what logistics. So this technology platform, this fintech platform, this can create huge difference to the benefit of all. So I request all of you to really contribute immensely to this session, and I'm sure that we are going to be much richer after this section. And I would attend this for 5-10 minutes, because in my own office and my family, around 30-40 people are suffering from COVID. So I have to manage the logistics and all these things. So best to all of you. And I wish that with this session, after this session, we come out with something concrete, and we will take this mission forward. And this is not the first step for this session. We will take it forward for the benefit of the mankind at large. Thank you very much. Thank you. Thank you, Sudan. Thank you, everybody.
Thank you so much, sir. I have just shared the YouTube live stream link. If anybody wants, who's not able to join right now but want to see it, then they can forward the link. Before moving on, we have a small video of mfine, which is one of our associate partners. So I'll just be playing it. I'm so sorry, I just heard that the audio was not clear. Share sound. Share. The audio is audio. mfine. It's an app which was founded in 2017. It is an on-demand digital primary healthcare platform which offers professional diagnostics and health checkup services that can be availed from the comfort of home, office, or even a spa. Since its inception, mfine has redefined the primary healthcare sector, driven by the passion to provide care, impelled with an unwavering focus on quality, and steered by groundbreaking artificial intelligence. mfine's endeavor has always been to make good health more accessible, reliable, and hassle-free to all. With the help of mfine, users can instantly consult doctors online and get health checks at home, all through the tap or click of a button. Again, we would like to thank mfine for being our associate partner and making this a possibility. With this, since we have all speakers on board, we will be moving to our first panel, Innovation, Cognitive Computing, and the Essence of Artificial Intelligence in Digital Healthcare in 21st Century. And for the same, we have a cohort of amazing speakers and an even amazing moderator. We have with us Mudit Danwate, who is the co-founder and chief executive officer of dozee. And before joining this company, he has worked with companies like Chrysler and Daimler and others. Then we have with us Mr. Adarsh Natarajan, who has more than a decade's experience working with the technology industry spanning various roles in multiple geographies. He is the person behind AI in their systems. We also have with us Mr. Rajesh Thangavil, who is an IIT Bombay alumni and former Biodesign Innovation Fellow of Center for Healthcare Entrepreneurship, IIT Hyderabad. We have with us from Russia, Dr. Daniel M. Bashmakov, who is the CEO of Amulet. And we will be having Mr. Bipin Babu, who is a young entrepreneur and an accredited investor and is on board of several companies, namely InnoWork, Blockspace, and Payza. And sir will be moderating this session. Over to you, sir.
Thank you so much, Suzanne, and to the BRICS team for putting this together. I would like to welcome all the panelists on board. Mudit from dozee, Mr. Adarsh from Indra, Mr. Rajesh from Aerobiosis, and Mr. Daniel. At the onset, I would request all the panelists one by one to take a moment and let us know why do you think digital healthcare itself is so important in the 21st century, right? We'll go into the details later on, but maybe we can start with Mudit. Maybe 1 minute. Why do you think digital healthcare is the future of healthcare going forward?
Thanks, Vibin. I think it's not just future; it's also the present, right? With the situation that we are in right now, right? There's just no way in which you are suddenly going to create more doctors, nurses, right? So going digital is the only probable way, right, in which you are going to increase the efficiency of whatever infrastructure you have today, and then make it more accessible, make it more economical for masses as well, right? So how to ensure quality reach masses, it is always technology has played a key role, and same will happen in healthcare as well, right? So that's why it is not just future but also the present. So, yeah,
perfectly put across, Mudit. Adarsh, can we have an anecdote from you?
Yeah, I think Mudit very nicely kind of articulated that. I think the key tenets of how going digital, especially in the healthcare space, plays a key pivotal role in actually increasing the accessibility, right, to the vast population for countries like India, which are mostly most of the population lives outside of the metros. Getting access to quality healthcare at affordable prices, right, is something that can happen only through digitization of many facets of healthcare as we know it, right? I mean, traditionally, most of the consultations have happened in person. Many of the touch points have actually been in person. So that we see now changing, and thanks to one of the silver linings of the pandemic has been how it has actually catalyzed that shift away from actually having to meet people in person to doing a lot of things virtually. I think all of this is enabled through only through digital health, Bipin. And I guess as Mudit also rightly mentioned, while the rate would have been, at going at a certain pace. It has certainly accelerated due to the pandemic, and we just don't see it in the future, but also in the present happening.
Perfect. Perfect. Thank you on that. Rajesh, do you want to step in now?
Yeah, thank you, Bibin. So as both of the previous panelists have clearly mentioned, Adarsh and Mudit, digitalization is what we require at present, to be frank. So the major problem, like being a bidesign fellow, we have spent multiple hours in hospitals. What we observed is, from when you look at like the crowd of people who come in, majority were like poor, the middle class people, and for them spending too much amount of money on healthcare was a major burden. But if you digitalize some basic things like getting data, or the doctor to patient ratio is also very minimal. But if we can put up remote monitoring and providing teleconsultation, so these are some of the features which was there in past, but now it has got accelerated, as Adarsh has clearly mentioned. So now I think this is the right moment where digitalization has been slowly penetrating into healthcare, and it would take it a pace in future, is what my understanding based on the current COVID scenario and based on what has been happening so far the last couple of years.
Superb. Daniel, it's your turn. Maybe you can spread some light on the same from a global scenario.
Даниэль, вам слово. Можете рассказать свое мнение о том, как обстоят дела.
Уважаемые дамы и господа, я благодарю вас за приглашение участвовать в этой конференции. И действительно, эта тема сейчас очень важна, даже не касаясь нашей работы, а касаясь здоровья, жизни наших граждан. Фабрис, вы переведите, пожалуйста.
Yeah. I thank you very much for your participation. This topic is extremely important, not just for the world, but for our own citizens of our own countries.
В России последние годы, особенно во время пандемии, очень сильно развивается медицина. И, конечно, то, что сейчас очень много научных исследований, которые проводятся в этой сфере, позволяет российской медицине достаточно занимать такую, скажем, получать серьезные достижения.
In Russia, over the last years with the pandemic, medicine has been developing very well. And я последнее предложение не услышал.
То, что сейчас очень много новых технологий и научных исследований поддерживается государством в рамках медицины.
The government has been supporting the development of a lot of medical technology and research over the past years.
И, конечно, без IT-технологий, без программного обеспечения, в рамках которого в отрасли работает наша компания, конечно бы, наверное, таких бы достижений не было.
Without IT programs that our companies are producing, we wouldn't have such great achievements.
И, конечно, мне очень интересно будет повзаимодействовать, так как я знаю, что в Индии и в других странах очень сильна такая народная медицина, которая вот в России, скажем, не так сильна и популярна. И вот в этом плане тоже, я думаю, мы найдем точки соприкосновения. Спасибо всем большое.
And of course, I'd be very interested in cooperation with some of your companies, as in Russia, we don't have some of the medicine that you have in India, and it would be great to get in touch on that point.
All right, thank you so much. My first question to all the panelists, out there, as a common man, I understand, artificial intelligence in health is going to, kind of give more control of health and well-being to the consumers. That's what, a basic definition of AI in health can be. What I want to ask from the experts out here is that if you look at a country like India, how do you think AI is impacting or enabling a lot of healthcare workers or consumers? Maybe you can take a context of your products and your companies as well. But overall, how is artificial intelligence helping the healthcare industry in our country or globally? Anybody can just take it up. Maybe we can start with others this time.
Sure. So Bipin, that's a very wide arcing kind of a question, even when you talk about healthcare itself in one sector, right? And that kind of encompasses a lot of activities that happen within the healthcare sector, starting all the way from, let's say, before the detection of a particular condition, all the way till even treatment, right? So we are talking about a complete arc, starting from detecting that there is something wrong with a person, then the prognosis, what treatment options, then even when it comes to drug discovery. So AI has kind of been kind of adopting, or rather is getting adopted into each of these different facets across the whole spectrum, right? And specifically, coming to what we do as a company, we are into detection of certain kind of cancers at the point of care. And for us, the choice of using artificial intelligence was not more as a slap on to an already existing product or a concept, but it was very central to what we are offering as a product, right? And without AI, we wouldn't have been able to make this product come alive. How we do it? We are in the computational pathology space, where we take biological samples and analyze them to see whether there is any abnormality specific to cancers at this point in time. And of course, our platform allows us to go across multiple conditions, even in the oncology space as well. So we ourselves are in the detection of the disease phase, if you look at it. And I'm sure Rajesh and Mudit also will add, and the other panels will add as well, as to what they're specifically doing in their own spaces using AI. But I think the whole promise of AI has been that a lot of value addition can be expected through AI coming into each of these aspects of healthcare. Awesome. Right, and I'd like to hand it over to the other panelists to add their bits as well.
Mudit, you want to take it up from there?
Sure. So beautifully put up by others, right? So just extending. So in healthcare, right, there are two facets of it, right? One which is more mundane and one which is more humane, right? And the one which is more mundane in nature, right, that is something that AI has to really take it up, because we have shortage of quality nurses, doctors, even all the resources over there. I'll just give you our example. So today, while we are setting up these devices, dozee devices in COVID care centers, in wards and so on, in critical wards, it is what it is replacing really the spot checks that nurses used to do every 3 to 4 hours, right? Taking their blood pressure, heart rate, respiration rate, saturation values and things like that. What we have done is simply just automated that entirely. So it has digitized it. One, what nurse used to do every 3 to 4 hours, now dozee is doing that 300 times a second. So now we have even a bigger data set. So using that, now the trend-based analysis are much stronger. Because of that, the patient outcomes are predicted earlier using the AI algorithm. And because of that, in the center that I am sitting in today, so using 150 devices which are put here, 30,000 patients have been monitored, about 2,000 alerts were raised. And out of that, about 647 ICU transfers were successfully accomplished in a timely manner, which has directly led to saving lives, right? So that is what in my very small world I have seen AI to do, but a lot can happen.
Awesome. Rajesh, your take on that?
Yeah. In terms of our company, what they do is, as Adarsh mentioned, the arc of healthcare, diagnostic and therapeutic. We thought let the devices be in the center where we can do both of them by taking data from the patient side and also automate the ventilators. That's what we observed in hospitals. So doctors who are, for example, night duties, they have to be there next to the ventilator to see the critical condition of the patient. And if it is improving, then they have to modulate and change the parameters. And also, when a doctor sets the breathing parameters at day 1, the breathing parameter changes. The patient condition might deteriorate or increase, get enhanced. So based on that, the doctors have to be next to them to change all these modulations. So what we thought, how can we automate this simple process? So this can be done very easily if we know the breathing pattern and the condition, patient's conditions. So we have incorporated certain sensors which is placed inside just next to the breathing wall. And based on the breathing pattern of the patient, our system automatically detects itself, okay, the breathing pattern is this much. Every 20 minutes, it tries to identify the patient's breathing pattern, the flow, and it automatically sets its the ventilator itself so that the breathing is completely synchronous to the system. That's a very simple AI we have incorporated, but it's very, very beneficial for the doctors. You don't have to be next to the ventilator for a long period of time. They can monitor the whole health condition of the patient, and then they just have to give the medication. They just have to concentrate only on the medication side, not on controlling the ventilator. That's what our take on the AI which we have incorporated in our system.
Just an added-on question to you, Rajesh. I was reading about this product from you called as Sarvastra. That's, I think,
No, I'm sorry, it's not ours.
Sorry, Bipin, that is a product from Mahindra.
Oh, that's from Mahindra. My apologies, Rajesh. Healthcare giants here. I'm just a techie. So, Daniel, my question to you. Daniel, can you hear me? Daniel, I would want to, in fact, the audience would want to know, I've been getting a couple of questions on my inbox, that, how is artificial intelligence or similar technologies playing a role in, specifically in Russia? I mean, can you mention some innovations, or companies or startups which are doing really amazing stuff using AI in healthcare? Susan, can you check if Daniel can hear us?
I'm just trying to see. So maybe you can ask the question later and you can move ahead with the other questions by the time I try to connect with him, sir. If that's fine.
Фабрис, вы переведете, да?
Да, конечно.
Да, я бы тогда коротенько тоже коснулся бы все-таки искусственного интеллекта, хотел поговорить, что эта тема очень также перспективна и развивается в России.
I'd like to start from a point of IA. This topic is very perspective and developed in Russia.
Я вот как раз заканчивал университет и защитил кандидатскую диссертацию в области нечеткой логики и принятия решений в области неопределенности.
Нечеткая что?
Нечеткая логика и неопределенные, как ситуации.
Ага.
Так называется.
Так, просто термин не знаком. Okay, I finished university with a candidate's degree in fuzzy application and theory of indefinition. Сейчас, неопределенности. Ага.
Да, вот. И, соответственно, вот то, о чем говорили коллеги, и использование искусственного интеллекта при выявлении рака, при выявлении других позиций, вот мне будет очень интересно с ними посотрудничать, потом, может быть, пообщаться для того, чтобы, возможно, какие-то разработки или совместные нам дальше сделать, или вот, может быть, их технологии здесь предложить у нас уже в России.
Mm-hmm. What my colleagues just said about AI being used with incidents of cancer, with being able to trace breathing patterns and do something based on that. This would be all very interesting for me to cooperate in and talk about with you. And perhaps your technology could be of use here in Russia.
Ну, я коротенько расскажу о нашей деятельности, о нашей группе компаний.
I'll have a quick word with you right now about the activities of my company.
All right.
Наша IT-компания работает на рынке разработки программного обеспечения с 1994 года.
Our company has been operating in the software development market since 1994.
Ну, за это время накоплен большой опыт выполнения комплексных проектов.
During this time, we've accumulated a lot of experience in the implementation of complex projects.
Наша компания успешно реализовала более 20 крупных проектов в ряде регионов России.
The company successfully implemented more than 20 large-scale projects in a number of regions in Russia.
Среди них клиент-серверные системы, различные интерфейсы для баз данных, ну и специализированное программное обеспечение.
Among them are client-server systems, various database interfaces, e-commerce solutions, and embedded systems for specialized software.
Значит, у нас есть программный продукт, который мы внедряем в ряде медицинских учреждений России.
Повторите, пожалуйста, еще раз.
Ну, у нас есть программные продукты для медицины, которые мы внедряем в ряде регионов России.
We have medical program products that are being implemented in a bunch of regions in Russia.
Ну и, наверное, я вижу, что уровень коллег достаточно высокий, и, соответственно, нет смысла, наверное, подробно рассказывать о программах. Ну, то есть с нашими программами работают как маленькие клиники, так и большие клиники.
Последнее предложение еще раз,
маленькие, с нашими программными продуктами работают как маленькие медицинские учреждения, так и крупные, крупные медицинские учреждения.
So I see that the educational level is very high among my colleagues here. So I wouldn't like to go into too much detail about how it all works, but I'd like to note that our products are used not just with small clinics, but also big ones, large scale ones.
Ну и я вот тогда уже завершу свое выступление тем, что мне будет интересно, как, например, предложить наши программные продукты на рынке стран, участников нашей конференции.
I'll conclude my statement with saying that we'd be interested in offering our products, our programs on the markets of the other participants in this conference.
Также рассмотреть интересные продукты, которые мы бы могли как внедрять здесь, в России, так как не все направления у нас задействованы, и являться представителями компаний, у которых вот есть разработки в этой отрасли.
And we'd also like to consider some of the products that you may be able to offer that could be of use to us here in Russia. И последнее предложение.
Да. Ну, то есть именно мы готовы выступать тут, быть представителями, и компаний, которые вот у которых есть эти продукты, которых нет в России.
And we're ready to represent your products the products of my Indian counterparts
Вот. Ну
on the Russian market.
и также участвовать в совместных научных разработках, совместных, ну, скажем, производстве программных продуктов и внедрении этих продуктов. То есть именно совместно с коллегами, объединив наши усилия.
And also, we're ready to cooperate with partners who in the actual development of software.
Thank you, Mr. Daniel. I think it's a great opportunity for my panelists from Adarsh, Rajesh, and Mudit. Maybe it's an open partnership opportunity with a counterpart in Russia. Maybe we can explore that post this panel discussion. However, that brings me to my next question. That I totally understand that digital health techniques, technology have surely impacted our healthcare system in a very, very positive manner and reduce a lot of inefficiencies. However, don't you think this products, these technologies are circulated in a limited strata of audience? I mean, not just our country, in a lot of other countries also, where there is income disparities, internet penetration is actually different than in a lot of other part of our country. No, do you think, I mean, there is a way we can ensure that these facilities which you people have built reaches those part of the country also, or those other countries also? I know it's a wider question, but I'm taking it on a level of common man. How is these going to help reach them? Help save lives there.
Is that question for anyone specifically, Bipin?
It's for all of you. Maybe you can relate it to the current scenario of COVID with some example. Who's going to go first? I can.
I'll go if you want. It's okay. I can go.
All right, Mudit, please go ahead.
Yeah. So yeah, relevant point, Bipin. I think one of the important things, moment we put like AI, right? Most of us actually, I think at least us, I will speak for us, we require internet. That is right now our current, one of the requirements. But indeed, we are working on a solution. The next version is actually an edge computing enabled. So in that, you don't even require internet per se. Having said that, even with internet requirement as well, even today, and this is prior to COVID. So in COVID, of course, we are enabling COVID centers across India. So right now we are not just present in 18 cities, but also in places like Beed in Maharashtra, in Bara district in Rajasthan, right? Chengalpattu in Tamil Nadu, right? So these are very small places where hardly you have, we had to even solve for power fluctuations and things like that also, right? Now, but even prior to COVID as well, we were helping, some PHCs for automating their heart failure report analysis, right? So using dozee, we were helping them to generate, so person will lie down and within 10 minutes, they will get a heart failure analysis of their myocardial performance index, of their cardiac contractility and things like that, which will generally only get with 2D Doppler echoes and things like that, right? But this portable device with just an internet connection, we are able to help that out with that as well. And internet connection also, we did solve partnering with few other major, telecom partners. So now, pan India, we have that almost 93% of the pin codes we are able to, provide services. And for last that 7% also, we're trying to work on the edge computing. In fact, even for places like Africa and all, also we have tried the solution there and it does work well, but pandemic did hit. So we tried to retract back and do solve things first here. But, we are getting ready for those kind of things as well.
Fantastic. Adarsh, you want to take on from there?
Yeah. So the way we see it, right, Bipin, there are, from the patient's point of view, to answer your question, they really don't care what is the underlying technology that makes things happen, right? So they're only going to be worried about what is the benefit that is given to them, right? Whether you achieve it by artificial intelligence, some other technology, or even magic, right? I mean, it really doesn't matter to them. And that's where I think, abstracting the final end beneficiary from the mechanics or how things are actually put together makes a lot of sense, right? And The other part also being that, as Mudit was mentioning, some part of it they're moving towards having an edge computing part, and this is where the whole concept of having a human-centric design for the specific beneficiaries that you are intending that to go, right, makes a lot of sense, right? So for us, when we were looking at point of care diagnostics, some of the constraints that exist in India as a geography is a hard constraint, right? You have variable power supply, you may have very flaky internet connections, and therefore we cannot design any system by not keeping these constraints in mind. And when you put these as hard constraints, the thought process itself completely changes, and you design products which are very relevant for a very resource constrained setting. And that is what we've done. And our platform can work in any condition without an active internet connection there. So we are a completely edge device based system, and even a flaky internet connection is all that is required in a non-real time. So these are the kind of aspects that you tend to bring in when you have that element very strongly centered on when you're innovating, when you're actually ideating and conceptualizing your product as well. So the two parts, right? From the patient side, they don't really care how you're going to do it, but nevertheless, when you're innovating, when you're conceptualizing an idea, we have to keep them in the center and then design the solution around them. And then, all the constraints that come with that become part of your thinking process.
All right. I just deviating a little, Adarsh, as I was mentioning about that Sarvastra, that's your product, right?
Sure.
Very, very keen to know that, it's about cervical cancers. And, as per my knowledge, I think it has, higher gestation period than, a lot of, other cancer variants. So how, your product is actually able to, kind of solve that problem? How is it analyzing? Because I think the turnaround time is across few weeks.
Yeah. So unfortunately, some of these, statistics that are there for cervical cancer is very disturbing. Unfortunately, India happens to be the world capital for cervical cancer. We have one woman dying every 7 minutes in India. And these are official numbers, mind you. So the real actual numbers can be, much worse than that. Now, fortunately or unfortunately, cervical cancer, as you rightly mentioned, has a very long gestation period, right? But the problem with that is the symptoms don't manifest very aggressively, and therefore women tend to not take it seriously. And by the time the symptoms actually manifest, they would have gone through a larger, to a later stage of the cancer, and therefore the survival rates drop down. Which is where in India, the incidence to mortality rate, right? If let's say 100 women get detected as having cancer, cervical cancer, at least about 50% of them don't survive, which means we are actually detecting the cancer very late in the cycle, despite cervical cancer being a very benign cancer comparatively. It's not a very aggressive cancer like leukemia or any of the other cancers, but despite that, we see this trend. Now, what does that point to is a very interesting fact that our detections are happening very late. Women are getting detected very late. And then the next question, why is that happening, right? It is because today, predominantly, if you have to go for an evidence-based testing, then the kind of skill sets and the infrastructure required to do that testing is not available in faraway centers away from metropolitan cities, right? And therefore women either have to leave, take several, the whole process of giving a sample and then getting a report back takes several weeks, as you rightly mentioned. So there's a whole lot of friction built in the system that's prevalent right now. So our whole endeavor has to be to eliminate that friction and take the whole testing to where the women are, and make it available through their neighborhood clinics, gynecology clinics, or primary health centers, thereby enabling faster, quick turnaround in terms of testing. Even a woman walking into her gynecologist for a normal checkup should also automatically get her cervical cancer test done, right? It should be as simple and as friction free as that. And that really what will change the entire statistic, disturbing statistic that I mentioned to you about. So that's been the thinking, Bipin, that healthcare predominantly, unfortunately, in a country like India has been more centralized because of not enough number of health professionals available, as Mudit was rightly mentioning, right? And the way the whole healthcare system has been configured, that it is very centralized in nature. Whereas the need of the hour is to have a more decentralized and a disaggregated healthcare system, right? So we need to have primary, secondary health centers available at every nook and corner of the country, but that's not happening. And that is where I think technologies like what Mudit is doing, what we are doing, and what even Rajesh spoke about, Daniel spoke about, all of them actually, in a way, if you look at it, at the underlying, all work towards decentralizing or democratizing this healthcare in a way, right? That's a little bit about.
Thank you so much, Adesh. I think a lot of insights.
But hopefully that, yeah.
Yeah. So Rajesh, I come to you now, and I would want to know that, how do we make sure that, computation technologies, AI, result in concrete and useful applications at the grassroots level of healthcare. As I was, just adding to my previous question, a lot of countries, even in our country, a lot of parts, don't even have the basic healthcare system. In such a scenario, how do we ensure that these technologies help us?
Yeah, so to add on to what Adarsh has mentioned, so in case of, let's look at a condition where primary healthcare center. When we were a part of this Biodiesel Innovation Fellowship, we visited even PHCs where we saw the basic amenities. What they have is the basic diagnostic. What they have is the proper bed. They would only give some tablets if there are anything, and if there is anything more severe, they would ask him to go to a town hospital or a district hospital, which will be around 20 to 30 kilometers far. That's a condition currently. So we thought, why can't we make, and this also increases a burden on the tertiary or the district hospitals. More number of patients move from village to the district hospitals. The second problem is, along with the patients, if the condition of the patient is very detrimental, for example, he has a heart attack and he has to be moved, the majority of the death in case of rural heart attack cases usually happen somewhere in this time period. So, and also even the ambulance, they are not highly equipped enough to carry life-saving devices like ventilators or defibrillators. So these are some of the problems which we observe. And the family of the patients, they lose the complete daily salary because they are not rich enough to handle and go there and stay in a city for a time period of a week or more than that. Even if the condition is like a surgery, it is a very, very huge amount of time. So these are the problems which you have observed under the primary healthcare center. This all thing can be reduced if we can provide the same healthcare facilities which is available in the town cities. This can be reduced. So how can we do that? It's by enhancing the facility which is present in the cities. We can move some of them. Now, some of examples like portable X-ray scans. Yes, it is available right now in PHCs. In some of the places, yes, it is available. But to analyze them, do we have enough doctors there? No, we don't have them. Do we have ICU beds in case of this rural hospitals? Very minimal. So how can you make it? So in that case, I think those will be a better option there, where it can be converted a proper ICU bed. I mean, a normal bed can be converted ICU bed. We just use a dozee over there. And that's what we also plan to do in future, where the ventilators will be available in at least every PSCs, so that the control and everything can be done by a doctor sitting somewhere in city, and who would remotely monitor the whole health parameters or the breathing parameters and control the system sitting somewhere far from the rural area. So that's what we are providing in terms of giving high computing and also some of the facilities which is not there in rural hospitals. But this can be enhanced, but there are challenges, as you have mentioned. Right now, I got disconnected because there was an internet failure. Even in city like a Bangalore, there was issues. So there there's a high percent chances that there might be cases like this. But yes, we do have a proper mobile internet connection. So considering all of them, in future, this will be overcome. The internet connection issues will be overcome. The other problem is frequent power failure. In a rural area like where I'm from, Tamil Nadu, the frequent power failure is very common. So to overcome that, we have given battery backup of around 6 hours, 5 to 6 hours. So these are some user design which we have considered when we are planning to deploy them in rural setup. We will definitely require them. So all these things one has to decide when they plan to make work around the device which they want to deploy in case of rural setups?
I mean, I think it's more of a learning session for me. In fact, I would want to mention, I came to know about dozee a couple of weeks back because, I was trying to transform one of my property in Lucknow as a makeshift COVID, 19 support center. So the work is still on. We got a permission from the government and all, because the scenario was extremely bad. But why did I come to know about dozee? Was because we didn't have too many doctors who was going to come and support there, because they're close to 100 odd rooms there in that property, and we didn't have additional doctors who can actually come and visit the patients there. That's where a couple of doctors said that there is this platform and a product called as dozee. Why don't you use that? We will monitor it from the nearest hospital. Having said that, my next question actually comes to the lot of tele consulting platforms which are there, right? Of course, though the pandemic has affected the nation devastatingly, and we have moved to teleconsultancy, do you think that teleconsultancy is more effective than having a face-to-face consultancy visit to a doctor? Because I believe every patient has something or the other specific, as per his body, his blood pressure, and so on and so forth. A lot of other details. But do you think it's more accurate? Or what's your thoughts on that? This is for everybody. I mean, it's for Daniel, Adarsh, Rajesh, and Mudit. I mean, what do you think about the teleconsulting platforms?
I think we also have Vishy also on with us, right? So I think best person to answer that from mfine, right? But generally, right? So teleconsultancy is a great boon. So it depends, right? Now, as more reports are getting easier, diagnostic labs are more widely available, right? Doctors can actually make a very good assessment, looking at the reports, right? And then prescribing. So I think this amalgamation of not just teleconsultation. So teleconsultation is not just connection to doctor, but also creating this entire network of, how that assessment will be done, right? And that's where both of them, when they come together, that's where it becomes effective. And I think that is where things are scaling up. And with this spike now, people are much more comfortable taking it over phone rather than going to a clinic, right? Because you can contract infection more in a clinic or hospital setting, right? So certainly if hospital visit can be avoided, should be avoided. That's the mantra right now.
Okay.
To add on to Mudit, I'll just want to give few feedbacks on teleconsultation. So what usually happens in a hospital, a tertiary care hospitals, is doctor will go for a round at least twice a day. And then what are the patient's condition, the nurses give the feedback, and based on that, the doctors decides what can be the medication changes. But in case of teleconsultation, every second, or I would say every minute data you have about the patient right in front of you. And that enhances the quality of care. So even if there is slight modification which is happening, so usually the doctors come to know after a few hours. But in case of teleconsultation, you have the contacts, for example, in case of us, where we know each and every breath of the patient. So if there is any slight fluctuation, the doctors gets an alarm, and then they can clearly modify, okay, fine, there's a condition deteriorating. Please ask the patient to be in a critical condition, or put him into change the parameters. So those things can be enhanced. That enhances the quality of care. As compared to going, and also there is a moral support, because the patients are more satisfied seeing that, okay, the doctor is in touch with me. It's like having a companion with you when you're in ICU bed.
Very nicely put across, Rajesh. Adesh, you want to add your points there?
Yeah, no, I think both Mudit and Rajesh have, fantastically articulated it. But my sense, Bibin, and to all of you, I'm sure Vishwanath, as Mudit was mentioning, is the person here, go-to person when it comes to teleconsultation. But my sense is we're just scratching the surface of it as of now. And I think while the pandemic is forcing certain kinds of behavioral changes in terms of, not wanting to meet people in person. For example, the patient not wanting to meet the doctor and go to a hospital or a clinic and meet the doctor. Vice versa, also the doctor preferring to not actually get in, come in contact with a lot of people. In this situation, teleconsultation is really a godsend, right? I mean, instead of completely disrupting the whole cycle, there is at least a continuity happening. But I guess in my sense, there are still a lot of touch points. I mean, human beings, social animals, we will want to kind of seek succor in actually going and talking to another human being who will reassure us. Maybe, the whole point of actually going and meeting another human being who's an expert, who knows, who we believe is an expert and who will guide us through this illness is actually a huge psychological boost that today cannot really be replicated in a very easy manner, right? And therefore, I think food for thought for all of us who are in one way or the other in telemedicine. I won't say teleconsultation, but I'll use a broader term of telemedicine. I think the whole aspect of bringing in the humane part, which Mudit did mention about in a different context, into the whole telemedicine angle is going to be very important going forward if we expect this to really take off.
All right, all right. So in the interest of time, gentlemen, I know I just want this to go on and on. I can learn with the audience are loving it. However, in the interest of time, I would want a few concluding remarks from all of you in context to the current scenario globally. That how are you going to recommend people to in such kind of a scenario today to use technology enabled healthcare systems? How you as an individual or a company are promoting your product? Is it a challenge? So maybe you can put it all together and give your concluding remarks for the panel. Maybe we can start with Daniel and then move towards Rajesh, Mudit and others, whichever way you want. Daniel, can you hear us?
Daniel, вы слышите, да?
Да, я слышу.
I just wanted to ask, this is closing remarks, yes?
That's correct.
Yeah. Так, вам слово на заключительное слово.
Коллеги, вот
да,
я очень рад и впечатлен вот нашей сегодняшней конференцией.
I'm very, very happy and impressed by today's conference.
Потому что здесь собрались представители разных стран, разных наций со своей спецификой именно в области здравоохранения.
Because here today, you've all from different countries and different backgrounds with different specializations. We've all come together to cooperate.
И, конечно, если мы воспользуемся вот такой возможностью, то сможем в рамках нашего сотрудничества в наших странах внедрить какие-то, скажем, новшества, которых по разным причинам у нас нет. То есть каждый в своей стране в сотрудничестве с другими участниками может внедрить что-то, что нет, в своей стране.
Through cooperation, we can fill the gaps in each other's countries in the areas that need implementation of such technologies and products.
Да, и многие вопросы и проблемы, которые здесь обсуждались, особенно о том, что да, в больших городах и оборудование лучше, и врачи лучше, а ведь в России тоже очень много жителей живут вне больших городов, в отдаленной местности, и вот такие системы, телеконсультации, да, и они очень важны и нужны.
And you talked about how the equipment and the doctors in more remote places in your countries is very relevant, and it's not less relevant in Russia. We have a lot of people here who live very remote, not close to cities, and the level of medicine is worse. Напомните, пожалуйста, к чему это было?
Ну, это к тому, что вот именно что нужно, вот это искусственный интеллект и вот эти системы телекоммуникаций очень также для России важная тема.
Yeah, these artificial intelligence systems and also the teleconsulting, they're just as important in Russia.
Да, и вот мы готовы с удовольствием к сотрудничеству. Я забыл сказать, что когда говорил про нашу компанию, у нас работает 86 человек, программисты, ну то есть все, которые в области именно разработки IT-систем, и мы открыты к сотрудничеству. Спасибо всем большое.
I'd like to just say that we're happy to cooperate, and forgot to tell you earlier that we have 86 people, and many of them, the majority of them, specialists in our company, and we're in a good place and looking to cooperate. Thank you very much.
Thank you so much, Daniel. I think since the beginning of the session, you've been talking about collaborations, and I'm sure my fellow panelists here would definitely look forward towards that. We'll connect over emails. Over to Adarsh. Your closing remarks, Adarsh.
Yeah, and specifically thanks for the organizing team to putting together a great panel discussion, Vipin, and for you doing a wonderful moderation. It's been a learning for me as well, listening to my fellow panelists, needless to say, we are in an inflection point when it comes to digital health. And I think not just innovators on one side. I know we're all the innovators on this panel, but what would be very interesting to see is also how the other side, which means the segments that we're talking about, who really are the healthcare service providers, who then need to adopt all of these digital health and then therefore make it available to a wider section of the society. How do they react? How quickly they adopt is all key things that are going to unfold over the next maybe few months, few years. But I think everyone realizes that we are at an inflection point when it comes to digital health, Bipin, and what I would like to end my thoughts with.
Thank you, Adarsh. Mudat, you want to take it up?
Sure. So first up, spasiba Daniel for being so patient and with us, and for offering us all the help. So we'll definitely look it up something. We'll do some work. As others had mentioned, right, in the current scenario, this is an inflection point and also more of a need of the hour, right? That digital health has to step up right now. The current infrastructure has, sorry to say this, but is not really coping up to the load, right? So only way it can really do it is if digital systems quickly, find their pace and, maybe stretch themselves, catapult themselves 5 years ahead, right? And if some people can see that as opportunity, but I see that more as of a call of a duty right now, right? We have to do it, right? Otherwise, we will go back in time more by 10 years in terms of financial economy and things like that, right? So how to do it? This is not just an opportunity, but need of the hour, and not just in India also, right? Globally, this is something which we have to do. So yeah.
Thank you so much, Mudit, for those remarks. Rajesh.
Thank you, Bipin, and the whole BRICS organizing team for putting up such a wonderful show. And the panelists, Adarsh and Mudit, and Daniel, who was very patient and he put hand forward for collaboration. We're looking forward to collaborate. I'll put up a mail for soon, probably next couple of weeks, for future collaboration in terms of developing some product using this Indo-Russian collaboration. The second important point as a closing remark, as both of my panelists, Adarsh and Mudit, has put forward, this is the right time where digitalizing the healthcare is something which we all look forward. And we need to be more, not, as I said, not looking as an opportunity, but also to solve, this is a responsibility to put forward and solve this unmet need, which is being still, I mean, it's been there last couple of decades, I would say. But now as a pandemic has struck, everyone is now looking at, okay, fine, what is the next option? Can we find something new? Then that's when we, all of us, have got exposed. And then, so ours is like 2019, or we just established as a company 2019, just 1 year old. But when we were talking about ventilator, no, there was a shortage of ventilator. Most of us just said, okay, there's something is a luxury we will not require at this moment. But when COVID struck, there was a shortage of, when we said there's a shortage of ventilator, there were a few investors, they said, please stop working on this idea, move to something else, because that will be something new. It might not be a viable product what you're trying to make. But then, but we were strong to understand, because we have seen the problem from the grassroots level. This is a problem, we stuck to it. And when COVID came in, everyone understood that there is a clear shortage of ventilator. And now we are in a process to scale up. So I think this is the right time to address this problem, which has been there for a decade. Thank you so much.
Thank you so much, Rajesh. You guys are doing such an inspiring job. Mudit, Adarsh, Rajesh, Daniel. It's been fantastic to speak to you guys. And since you guys are there in the health industry, I would wish all the good health to you and your family. Right? Stay safe. Take care. To Daniel, how do we call it in Russian? Zabotitsa, Daniel. And looking forward to meet you guys in person sometime soon, collaborate and do some great job across BRICS nations and in India. Thank you so much to also the audience for being so patient. They have sent a lot of questions too, but I don't know, Suzanne, if you can take up some question.
I think you have time for 2 questions, and then maybe we can move ahead. But keep the answers like really crisp.
Yeah, so the panelists, my apologies, I took your closing remarks, but we have a couple of questions. Okay, and anybody wants to raise hands? These are really long questions which people have asked me. So then you want to take up any of them and throw it to the panelists?
I can't see.
All right, what we're going to do is, I think there are huge questions. It's going to take 2 minutes, 3 minutes to read only the question, right? So what we're going to do is we're going to mail these questions to our panelists, so that, and I'm sure you're going to respond to them, and we're going to pass it on to the audience, right? Thank you so much, Suzanne, for having me also, on board as a moderator. It was a fantastic session. Thank you so much, everybody. Thank you to the speakers. Stay safe. I will not say stay home, stay safe.
Thank you. Thanks all.
Bye-bye.
So were there questions?
Suzanne, your voice is breaking, so we are not able to hear you.
Suzanne, the voice is a little muffled. I'm not too sure it's only for me or it's for everyone.
No, it's for everybody. Okay.
Yeah, obviously the amazing translator joining us, and it was indeed a very insightful day. We would be moving forward, and before that, let me see my screen.
Possibly without dozee, it could have been fatal for her.
Dozee is India's first contactless remote vitals monitor. Its thin sensor sheet, once placed under the mattress, tracks person's heartbeat, respiration, sleep,
I'm just having some network problems.
Here's
back
what
at home.
convinced me about the importance of having dozee as a remote health monitoring device. We had an elderly patient living alone. Her daughter had placed dozee under her mattress so that both she and us could monitor her vitals at the healthcare facility remotely. This one time we got an alert indicating a decrease in her heartbeat levels from the device. When we inquired her regarding that, she just brushed it aside, telling that she was just feeling a little bit tired that day and passed it off as an age-related problem. So we called her in for an additional medical test and found out that she had an abnormal
Suzanne, is it okay to start? I'm waiting for your go ahead.
Yeah, Ankit, I think you should start.
Sorry, sir.
Give us 2 minutes. Suzanne is having a bad network. Let her figure out a network zone. Give us 2 minutes, please.
Sure, Ankit.
Ma'am, can you hear me?
Yeah, we can hear you now loud and clear.
Yes,
Much
Suzanne,
better.
let's continue.
Yes, yes.
You've got some problem again.
Dipangna, can you take over, please?
Still can't hear anything.
No, still struggling.
I'm so sorry. I'm having some network issues.
Suzanne, can you mute yourself, please? Suzanne, can you mute yourself?
Play the video the moment. Sorry, sir.
Yeah. Are you?
Sir, can you hear me? My
Yeah.
internet connection is really unstable.
Much better, Suzanne.
We can hear you now, but your network is fluctuating. Do you want to continue or Dipangna should take over?
Can you now?
That really is very spooky, and it does sound like a epic horror movie.
Suzanne has moved back to her hometown in Guwahati to work from.
So maybe we should just get started. I think
my network is really fluctuating really bad.
So
it's
Suzanne,
already 15 minutes late.
Suzanne, Dipangna will take over. You may mute yourself.
Hello, good evening, everybody. I'll request all the other members, apart from the speakers, to mute their screens so there is no disturbance in the background. Thank you so much. So we have Mr. Ankit Jham, who's the Senior Capability Advisor at KPMG, and he's also the advisor to Steering Committee of BRICS CCI Young Leaders. Sir, welcome, and please take over the sessions with all our speakers for panel number 2. Thank you so much.
Thank you. Thank you, Deepangana.
You're on mute, Ankit.
Yes. I think some invisible force, somebody is muting me again and again. But yeah, good evening, everyone. This has been a fantastic beginning to the evening. One of the best things which has happened since the morning and in the last 1 week of getting news from all over of plasma, oxygen cylinder shortage. But I think getting people seeing together virtually is a breath of fresh air. And I genuinely mean that when I say so. My role has been very difficult, but I think it's largely easy because the difficult heavy lifting is to be done by all of you. They told me to ask you some very difficult questions, make it interesting and just look glamorous. So that's what I'm going to do today. But you know, in the last 2 days, I tried reading and researching more about you, and I was genuinely impressed, and I was genuinely interested in knowing each one of you. So while I'm not going to be preaching to the choir by giving your introductions, but definitely I'm going to give you one short thing which I've seen while I was looking up for you. What I've learned when I was reading about Geeta is the fantastic work she's doing in the space of breast cancer. I think marrying technology and healthcare is a nobility in itself. And I have many questions to ask because I got enthused by the fact that how technology, artificial intelligence, machine learning could save lives, preempt and predict breast cancers, which is more accurate than anyone else. Simply fantastic. Dr. Ramchandran, first I want to ask, I hope everything's all right. I understand Dr. Gupta was supposed to come, but he got diagnosed with COVID, or he's getting diagnosed with COVID as we speak, but I'm hoping that he's all right.
He's all right. He's better today. And I'm sorry, my internet connection too is unstable today, extremely unstable. I think Bangalore for some reason. So
we can hear you loud and clear. So far, so good.
Interrupt you, Ankit sir, 1 second. I'll just introduce all the speakers quickly. So,
go ahead.
Instituting essential foundations for change in digital health and the importance of safe and inclusive services. We have with us today Ms. Geetu Manjunath, CEO and co-founder, Nirmai, Dr. Ramachandran Balaji, Consultant Digital Health Strategy at ACCESS Health International, Vishal Gondal, founder and CEO at GOQII, Vishwanath NS, Chief Financial Officer of mfine, Nicole Lipin, CEO Simply Safe, moderated by Mr. Ankit Jham, Advisor, Senior Associate Director, Capability Development, KPMG. Dr. Geeta Manjunath is the founder, CEO, and CTO of Nirmai Health Analytics and has led the company to develop a breakthrough AI solutions for detecting early-stage breast cancer in a non-invasive, radiation-free manner. She holds a PhD from IISc and Management Education from Kellogg's, Chicago. She has proposed and led multiple AI projects at Xerox Research and Hewlett-Packard India. She has received many international and national recognition for her innovations and entrepreneurial work, including CSI Gold Medal, Barack Winner Award 2018, and is also on the Forbes list of Top 20 Self-Made Women 2020. She was recently awarded the Accenture Vahini Innovator of the Year Award from Economic Times and Women Entrepreneur of the Year 2020 by Biospectrum India, and is an inventor of 16 US patents and more pending grant. Welcome, Dr. Geeta Manjunath. Dr. Balaji led a 15-member Digital Health Strategy Council for Access Health International in India. This resulted in a comprehensive 360-degree perspective of the global digital health journey and a resultant vision for India's digital health needs. Currently, he is mentoring a group of 25+ digital health startups through a social entrepreneurship accelerator program launched by Access Health International. For an international healthcare think tank in association with one of the world's largest charitable foundations, Dr. Balaji was appointed head of an independent digital health strategy council, consisting of national and international experts in digital health. Welcome, sir. Vishal Gondal is an Indian entrepreneur and an angel investor. He is the founder and CEO of GOQI, pronounced GOQI. Mr. Gondal is also founded the game development and publishing company India Games. He briefly served as the managing director of digital division of the Walt Disney Company India from September 2012 to June 2013. Welcome, sir. NS Vishwanathan is the CFO of mfine, an on-demand healthcare platform that aims to address the huge gaps in healthcare accessibility in India. With over 30 years of experience, Vishwanath is a seasoned expert at driving financial strategy. His extensive career has seen him at the helm of financial decision-making and driving and executing strategy at several organizations. Be it raising funds through public or private investors, raising debt through banks and NBFCs, or designing systems that drive efficiencies in the organization, the focus has always been finance for business. Prior to mfine, he has held the CFO portfolio at GVK Biosciences, Newland Laboratories, Care Group of Hospitals, and Sunshine Hospitals. Lastly, Mr. Lipin Nicolay, CEO of SimplySafe, he's the owner and foundation of the company SimplySafe LLC, has been developing commercial software for the orthodontic market for more than 10 years. He runs businesses, SimplySafe LLC, and manages the developments. Welcome everybody, over to you, sir.
Thank you, Dipangana. So I'm going to pick from where I was. Dr. Amachandran, you were talking about Dr. Gupta. I'm glad to hear that he's doing well. I also read about your work and the quality of work you've done. I think what you do cuts across what everyone is doing, advising and running a council on digital health strategy. And one part of my conversation is going to be establishing a robust digital health strategy. And I'm sure that everyone's going to learn something. Vishal, I downloaded the Goki app today and I found it really amazing. I knew about it because of Akshay Kumar, hand on heart. But I think today I started using Goki app and today I was using mfine also. I think very, very nicely created, built user interface. I've been using Amazon Huawei's smartwatch. But I'm going to take some classes from Goki. The idea which you've been used, the underlying premise of integrating lifestyle, healthcare with insurance and all of it together, I think is simply fantastic. Mr. Vishwanathan, I think I'm going to seek some financial acumen from you. There is a lot of startup, young kids, and there's a lot of young energy which is falling in love with raising money, and it's getting raised. So we want your advice on how is it that when you have an idea, how is it that you can raise funds? And I hear and I see that you've done a lot of work in that space. So I'm going to count on you for that. Nikolai, welcome to this discussion. I went to YouTube and saw some of the videos you had put. Absolutely fantastic how softwares can be used from an orthodontic viewpoint to bridge gaps. And I saw some of those explanations were overwhelming and absolutely intellectually stimulating. So on that note, ladies and gentlemen, I'd like to welcome all of you to this forum. Our humble objective is to create a knowledge sharing platform where we widen perspectives, we share what we know with each other, and with the hope and intent that people who are listening to this, they go back a tad wiser, a tad more aware of what's happening in the digital health sector and how can they contribute. At the outset, I think I truly believe that if there is, like the Japanese concept of ikigai, if there is a place where the nobility, service, what people need, what we love to do meets, I think digital healthcare technology is one of that space. It has the ability to uplift mankind. It has the ability to improve quality of life. And each one of you, while you might see yourselves as entrepreneurs, I'm going to see yourselves as noble social entrepreneurs, because the outcome of the business might just not be making money. The outcome of the business is to raise a population of people which is built on quality of healthcare. And that's exactly why it's so fantastic to speaking to each one of you. The format which I'm going to follow is, I of course have certain set of questions to ask, and I'm going to start asking them soon, but we'll try and keep some space towards the end of it for audience questions. And for the first, let's say 25 to 30 minutes, I'll try and ask some generic questions, and basis your answers, I'll try and ask you some specific questions basis your expertise. Okay, so that's how the game is going to be played. My very first question, which comes to my mind, is that call it an opening remark or call it an elevator speech if we were to, but for a common man, and it might be sometimes difficult to comprehend how did people ended up marrying technology with healthcare, because the conception of healthcare is you go to a doctor, he gives you a medicine, and then you get all right. Okay. Common man, or for say, sometimes I ask that if you were to explain your business model to a sixth standard individual, how would you explain that in 45 seconds? And that could be your opening remark, but remember that you have to explain your business model to someone who's in sixth. Let's see if you can take that challenge and demystify digitalization of healthcare. Dr. Ramchandra, since you're giving me the most amount of smiles, I'm going to start with you, if that's all right with you.
That's perfectly fine. I'm just reminded of Richard Feynman's statement, which you took basically, that if you can't explain physics to an 8-year-old, you don't know what you're talking about.
So yes, go for it. Happy
Very simple. We don't have a business model. We are a not-for-profit think tank, and the team has spent about almost every team member has spent more than 2 decades in digital health. But what we are trying to achieve is the free flow of health information across the entire ecosystem. And the best way to put it to a layman would be, today, if you get COVID, instead of going searching for all the information that you need, all the information will come to you by somebody else. You don't even have to ask. All you have to say is you have COVID. And 10 different people from 10 different sources across public and private healthcare will jump and be at your disposal. You will have a choice to decide where you want to go, what you want to do, what area you want to get help from. Simple. The bottom line for everything is interoperability of data. For all AI, for all health services, for all scaling, for all access, for all quality, for all state government, for all private players. It is the interoperability of healthcare data that will seed this scenario.
Thank you so much for that. That was a lovely start. Geeta Manjunath, I'd like to hear from you. It's a very, very powerful business proposition with the right kind of intent and the heart at the right place. How would you explain this to a sixth standard?
Hi, thanks a lot for the long, multi-introduction about ourselves, and then wonderful panel to be part of. Yeah, so I'm Geeta, founder and CEO of Niramai. Niramai stands for being healthy. Niramai, no diseases. Exactly what we are attempting to do using technology. The first problem we are attempting to solve this way is the biggest life-taking disease in women, which is breast cancer. 680,000, that is 680,000 women die every year, COVID 1 year. Every year we lose so many women around the world. In India, every 5 minutes we lose a lady to breast cancer. Nobody needs to die for breast cancer. Breast cancer is curable. So what we're attempting to do is to stop deaths due to breast cancer. How are we doing it? We have come up with a completely new method of detecting breast cancer, which is privacy aware. That is, women don't have to disrobe in front of others to do the test. It's very, very important for people to do this test. Early detection. You have to detect it before a lump is formed, a big lump and all of that is formed. You have to do early detection. Obviously, it has to be affordable and made available wherever and whenever the lady needs. So all of this we are addressing using a wonderful technology that we have come up with, made in India, patented, and all of that good stuff, where the lady enters into a booth. There is a small thermal sensor in front of her, 3 feet from her. And she just sits like this and turns around a stool for 10 minutes and she comes out, her report will be ready. Nobody would have seen her, touched her, or there is no radiation, nothing. Automated reporting and doing it at 1/100th the cost of mammography, which is the default standard. So that is what we have done. And I'll be very glad to talk more about it as needed.
Fantastic. Thank you. Thank you so much. Vishal, I want to come to you. What a Gen Y idea. What a Gen Y idea to change how we live. And I think it's impacting everyone. You probably have the easiest job to explain this to a sixth standard individual, but I still want to hear this out from you. That give it a shot. How would you explain this?
So I think the way Goki is, and it's not just for a sixth standard or 6-year-old or a 60-year-old. I believe that life is a game, and to win the game of life, you have to attain live longer. You don't, like a game, have 20 lives, right? You only have one life. And the problem is that, you know, your grandfather, and you have seen people right now in their old age, you know, even though in India, the average expectancy is much lower, 67, but the quality of life as people are aging is very, very poor. You know, because of comorbidities, people are in dialysis, knee replacement, hip replacement. So it is not good. So to win the game of life, you need to level up, and to level up, you need to play like a pro. And the way you play the game of life is by, you know, being active, by eating healthy food, by exercising your brain, and by exercising your mind, which is, you know, doing all kinds of meditation, spirituality, etc. So I think this is a game where I believe that longevity of 100 years is easily doable. So while, you know, our older generation is stuck at 67, there is no reason why people who are in their 20s and 30s can't aim at living 100 years, but at age 100, they could be running a marathon. So I think that's what Goki is trying to do. And it's not very difficult. And we have already seen that traditional healthcare has completely failed the world. I think this whole sick care model of waiting people to get sick and then giving them all kinds of medicine just doesn't work. We have sitting ducks, and one coronavirus has shown what can happen, you know. And by the way things are going, you know, we may have a virus coming up every year, every 5 years, with the mutations of this. And you know, unlike you know, when there was nuclear attack or terrorism, where governments could, you know, invest in security and, you know, soldiers and guards, over here the only way to do it is make every citizen a soldier. And the way your citizen can fight is by having a healthy immune system. So that's what we are trying to do, make you live 100 years.
Thank you, Vishal, and thank you for doing that. Very well put. Nicolai, I want to reach out to you. It's a very unique, creative idea, and I've been someone, personal confession, I've been afraid of dentists for all my life. Now, at least for 80% of my aware, conscious life. So I want to ask you that if you were to explain this and simplify what you do, Nicolai, how would you want to do that and share with the audiences around?
Hello, my name is Nikolai Lipin. I am owner and founder of the company SimplySafe. We produce software for creation and manufacturing clear aligners. These are orthodontic aligners to make that allows make straight teeth. We provide a full entire platform for interaction between a patient and a company who produces aligners and a doctor who treats a patient. Also, we develop improved technology of clear aligners and make them more efficient. Also, we have been developing technology to make it is remote to make remote treatment possible for patients. It is a modern trend in the different countries. It's all. Thank you.
Thank you. Thank you so much. Thank you so much, Nicolai. Mr. Vishwanathan, sorry for the long wait, but your turn finally arrives. Now, demystify what mfine is doing, and it's a wonderful platform. I have it on my mobile now. Some people confuse it with Practo, but you won't believe I actually went on Google to figure out how does the two platforms differ, and I figured that Practo is completely different, and you must take pride in the fact that we are very different than Practo. But I think the world's confusing you with Practo all the time. But how are you going to demystify the entire business model for all of us? Over to you.
Yeah, I'll do that. Thank you for this opportunity, Ankit. First of all, I just want to tell you that I'm no more a finance expert. That's a placeholder title, what was left after all the other alphabets which the founders took. So that was the only alphabet I had to work with. It's very simple. I don't need 45 seconds to explain what mfine does. We are doing two simple things. One, we are trying to create access of health to every citizen of this country. By access, we mean that we enable doctors to reach to somebody's house and doctors are all busy. We know the number of shortages, etc. So we have built technology where a doctor can actually finish a consultation in 3 to 5 minutes. So we are making it more productive. So that's how we do access. And the other problem we are trying to solve is availability, to see that a person gets his health requirements delivered at his home. So that be it consultation, be it lab tests, be it medicines, he gets at home. That's the vision we are trying to. We are very far away from where we are to reach. While from a consultation perspective, we are there from Kargil to Kanyakumari and from Kutch to Kalimpong. For further east, I didn't get a name with the K. But and in terms of pharmacy, we are working on building. We are building cities by cities, I think. And for the path and lab tests, we are currently in close to 4,000 pin codes covering 60% of the population. We are hoping to be there in next 3 to 5 years and primarily we work with hospitals to ensure that apart from creating access and availability, make something which is of acceptable quality and we don't worry about the quality of delivery of this science.
Absolutely. Fantastic. My second set of questions, and I'm going to, Vishwanath, I'm going to start with you because you mentioned something very interesting, that you got to offer what you're doing to everyone in the country, and that's inclusive. That can only possible when we have an infrastructure institutionalized in all pockets of the country. In a country like ours, and I remember reading a book by Mr. Bonga, 76% Solution, which said that rural population is 76% and the rest is urban population. And if you have to figure out the business model, you have to tap rural population. My question comes from that rural population, that in a place like, let's say, Eta Mainpuri, in a place like Angud in Bhubaneswar, and I've had the luxury of working in some of these places, which are very remote locations. What is your strategy? What kind of challenges are you facing? And how do you plan to become more inclusive? And that's the question which I will come with to each one of you, because I'm hoping that that's the challenge which everyone's going to face at the end of the day. So Mr. Vishwanath, over to you.
So I'll answer it in two parts, how we are trying to achieve it. First is currently the access solution, what we're having, where somebody who has a smartphone and an internet connection and he downloads the app, he's able to access more than 4,000 doctors and 600 plus hospitals, where they access these doctors based on proximity and availability of that doctor. That is one simple solution. So now the key word is whether he has a smartphone to access this person. Now, how do we give access to people who don't have a smartphone? And that's something as a project which I'm working now, we in India, interestingly, there are a lot of financial inclusive companies like Spice Money, FIA, who are doing this banking mitra jobs at the last mile financial inclusion. We have now working with a couple of networks to give those agents the ability to create access to the doctors, which is a classic telemedicine solution of saying remote clinics. So we are basically trying to make each of these 350,000 to 500,000. It's a pilot we have started very small. Currently 200, 300 pilots we are running as of now, and we hope to scale that pilot. Once we scale that pilot, we are sure that we will be there in every village with a population of 2,000 people.
Fantastic.
And the green shoots are very interesting. As of now, we are writing some paid pilots, some non-paid pilots. Yesterday we started, this is a social initiative we started with Manish Mundra of Drishyam Films and Stand Plus, an ambulance company, where we gave just a call-in number where people can call and we initiate a consultation for them, and where we send a link to the patient who can then possibly do a consultation like he's doing in Zoom consultation. So there are multiple ways to reach today, through a phone call or to a remote clinic, and then of course our app. So consultation we have definitely reached. I think we have to figure out a way to make the lab and the medicine reach to those pin codes. That's
very, very impressive to hear that, Krishna. Very impressive. Let me take a very different viewpoint from Nikolay. Nikolay, if you're there, my question to you comes from that, hey, look at your geography. Share some best practices with us, that how have you managed to penetrate deeper in your own geography, and how is it that you would want to have a view, or what is your view towards the Indian market? Nikolay, I'd like to have your views. Nikolay, you there?
Здесь присутствует переводчик?
Yes, you'll have to, yes. What steps is your organization taking to expand in your current geography?
The language market is growing every month and every year, and I perfectly know patients want and doctors want get a low price for aligners and get treatment cheaper. We are trying to make automatization of routine processes and to reduce of costs of companies who produces aligners, and we offer to market more advanced technologies that uses neural networks and other additional additional systems that allows to companies reduce their costs and to focus them on their key product.
Got it. So I think what he's trying to say is there is an effort and distribution of network, and the value proposition which they're offering is reduction in costs, and that's how they're trying to increase the chain of medical practitioners who are associated with them. Nicola, I'm hoping that I got that right.
Could you please repeat your question? I have bad connection.
Sure, no problems. I was saying that what I understood from your answer was that you're trying to focus on reduction of costs and you're increasing the network. And those are the two things you've been trying to do. Is that right?
Yes.
Thank you. Thank you, Nicola. Okay. My next stop would be Vishal, you. The business model which you have is applicable everywhere. I mean, it could start from the moment you open your eyes to the moment you close your eyes. What is your inclusion strategy, and how is it that you are planning to spread Goki in all pockets, all regions? Go for it.
So I think, this fundamental assumption that healthcare is a problem of access and information and doctor consultation, I think is flawed. And the reason is that everybody knows they should not be smoking or drinking or eating fried food or abusing their body, but they still do it. And it's not because of lack of information. In fact, everybody today is opening WhatsApp and trying to self-medicate themselves and stalking remdesivir and all of these things. But the reality is that it is a problem of motivation. And that's where my background comes in the world of computer games. And one thing which we know how to handle motivation in gaming is very well known. We can make you play Candy Crush Saga for the rest of your life. So when you look at the size of what we are trying to do, we are trying to do behavior modification for your health and lifestyle. So which almost spans across every aspect of your life. So whether it's the food you eat, it's the clothes you wear, it's the thoughts you have, it's the platforms you use. So Goki is kind of trying to be, like I said, we are trying to make you a player in the game of life. So in fact, we don't even call our users customers or patients, like how most of the other platforms refer to them. Our users are called players. And no wonder that our brand ambassador is also called the Khiladi Akshay. So the idea is that we want you to enjoy living a healthy life. The problem is that nobody wants to install health apps because they don't want to be reminded of a doctor, and nobody wants a 3-minute consultation. The fundamental problem with healthcare is lack of empathy. A doctor unfortunately doesn't have the time to spend and understand your problem and is just trying to, roll you over to the next patient. And which is what the whole challenge is. In 3 minutes, they can possibly treat your symptoms. You say you have a headache and they'll give you a medicine for that. But trying to understand the reason for your headache is itself the problem here, right? You need to get to the root cause. And even though I'm not a doctor, I can tell you that a lot of these things are interconnected. Your physical well-being is connected with your mental well-being, and that is connected with your social well-being. And which is why at Goki we look at this as a mind, body, and environment. In fact, doing good, like good karma, is actually part of our business model. Every time you walk, we give you karma points which you donate to charity. So we believe that uh, as part of being a good person and being healthy yourself, you need to contribute to the world. So our model is very different, like I said, which is why traditional healthcare will never understand it, because they are all going to be trying to sell their medicines and trying to sell their injections. But I think post this pandemic, I think governments worldwide are going to take a big U-turn on the way their healthcare expenditure is going to go, and preventive healthcare is really the future.
Fantastic, fantastic. And Vishal, I must compliment, because I do a lot of work in the space of nudge theory and behavioral economics and gamification. And while I was going through Goki, I think it appeals, and it's a 10 on 10 platform. It triggers the right kind of dopamine. It has an element of storytelling. It releases a certain kind of serotonin time to time, and it ties up with the larger narrative of doing higher purpose and doing good and finding a meaning of life.
So that's our oxytocin.
Oxytocin, yes. So I think you're bringing...
And we hate cortisol. Yeah.
You hate cortisol. And it says that conveniently, and I think the platform is nicely built on the principles of nudge theory. I'm sure you would have read the book by Richard Thaler. So fantastic work there, and an even better answer. Dr. Ramachandran, I'm going to come to you now. Your think tank actually cuts across all of this, and you're the knowledge repository, the knowledge house of the hows and whys. So what is your 2 cents on ensuring that the digital strategy is inclusive and it touches all lives?
Yeah, so to be really inclusive, there are a few important things that you have to take into account when you approach digital health. One, it has to take into account the ground realities, and as many people have said here, behavior is one, the lack of a smartphone is another, the lack of even access to telephone is a third, and the basic minimum ground reality has to be taken into account. So let's say the best way to give an analogy is, when you start driving, don't drive a Porsche, start with an Alto. That is the way we see countries like ours scaling up rapidly in terms of digital health. And what are the components of this? So one, you have to have widespread digital systems. One of the ways is what Vishal is doing on a patient basis. But on an industry basis or a healthcare system basis, you have to have minimal viable platforms available out there. And at the size and scale it's required, typically commercial entities find it difficult to do that. So one of the components is a set of minimal viable product building blocks, which we have created and put out into open source for anybody to take on. It's not us, it's everybody who wants to build a simple system can just use this in the service of the nation. So one is the minimal viable product set. Two, to really stitch all this together in terms of inclusivity, you need to have all these systems, including legacy systems, easily interoperable. That means there should be data flow very simply across every system, right up to the man who doesn't have a phone. How do you do that? So, concepts like e-objects, and you can, I will send out later to everybody our open source community and all the digital assets on it that you can use to facilitate interoperability. This is tech agnostic. This is platform agnostic. It is open source. It is free. It is simple. It aligns to India's notified standards. It aligns to international standards. It is no cost of change. It is, how do I put it? Extremely simple. There are predefined tools that you can use to get to this standardization. And basically, it's like a crystal. You put it in and you crystallize the entire environment around interoperability. So these two factors, the key are these two factors: the minimal viable set of building blocks for systems for the industry, and into simple interoperability specifications and assets that can be used by everybody. If you do these two at scale, you're basically done. Then the rest of it is adoption, implementation, etc., etc. At the fundamental level, these are the two main things. Once you get that, and we have tested this on the ground with our social entrepreneurship accelerator, 40 plus companies are using this to be interoperable, to align to standards, and they proved that it works on the ground. It's very simple to use. So apart from the actual putting up the building blocks, we have actually tested on the ground as well. And then we are institutionalizing it through academic partnerships and capacity building initiatives and all of that. So if you look at it, inclusivity scale is through these 3 or 4 basic initiatives, and every one of y'all can come up and take these digital assets that are out in public good and use them for the service of the nation and the global patient.
Fantastic. Thank you so much for that viewpoint. I want to come to you, Geeta Manjunath, and I have a very specific ask actually. Breast cancer struggles the right kind of education, struggles the right kind of action, not only in an uneducated community, but at times in an educated community also, which is why timely action and timely detection is where your USP lies. But my question from a rural standpoint comes that there might have been lives where it went undetected, it might have not been unaddressed. People would not have the courage to talk about it because of whatever social taboo reasons. How are you coping up with that struggle? Because your struggle when it comes to inclusivity is basically coming from a mentality. And maybe I'm wrong, but please tell me if I'm right. And if yes, then how are you coping up with that?
I think you are partly right, I would say, if I can see it that way, because I think the main problem we are losing so many lives is the current tests that are available are not at all affordable or accessible, right? The high quality healthcare to make it affordable and accessible. It sounds like a political statement, but that's exactly the gap which is stopping rural, basically I call it like like we have digital divide, we have healthcare divide. Right?
Yeah.
Which is really infrastructure, doctors don't want to go to the villages. Infrastructure is so expensive that they don't get the scale that's needed to get the ROI for the equipment that they've invested. So you only have primary healthcare, a budget of 5 lakh rupees for the whole year. Can you imagine, including the personnel, everything? That's also more, right? That is the kind of thing we have, and how do we provide the same kind of healthcare to them, right? Of course, one is wonderful telemedicine. We talked a lot about it, and Vishy talked about it, and so on, right? That's great, right? But there are certain things that require point of care tests that have to be done to check the current state of affairs, current state of health of the person. So if you look at breast cancer per se, which is what we want to solve one by one, right? So that we know we can sort of address all the issues there, because our solution that we have built, what's called thermalytics, is applicable for many, many more cancers and many, many more diseases as well. But we start with breast cancer as a startup. So breast cancer cost of one test is 3,500 rupees, right? And that's the analog. Like if you take digital, it's 7,000 rupees. Who will go for this test every year in order to do early detection? It's absolutely, forget about rural, even an urban working lady in an MNC don't want to spend that money because everybody thinks we won't get cancer, right? So that's that. So what we have done at Niramai is to bring down that to 100 rupees, or even basically it's sponsored, right? We put a CSR engagement around it. It's actually free for the rural people at that stage, because we bring down the capex, which is 1 crore in mammography, to less than 8 lakhs, right? Which is like 1/20th the cost of the capex. So more people can invest in it in order to provide this in multiple places. Plus, the cost of operations is reduced. One is, why are we able to get to under 100 rupees? Because we don't need a doctor to operate it in rural areas. We don't need a doctor at all. You can train a health worker in 2 days to do this test on every lady, right? And for that, what have we done at technology level? One is we have completely done an end-to-end automation. The end-to-end automation means when we give this to a health worker, they make a lot of mistakes as well. How can the system heal itself, if there is a mistake, or guide the person that she's doing a mistake? If she's taken an image of of the young lady or old lady, but she has not taken it in the right view, it will immediately say, look, why don't you move the person and then take that again. So these kinds of guidances are provided, assuming the skill of the technician is not so great. They just need to know how to click a few keyboard buttons on laptop right now, but yeah, phone as well. So that is a skill reader. So they need not be a medical kind of person also. And they generate your report, and we guarantee that report is correct, right? There is no doubt. So the accuracy of the whole pipeline also has to be moved. But how do you get this differentiated pricing, right? I mean, you can't charge the same thing as 1,000 plus and here 100 rupees. That we do by changing what we actually show to the end user. So we have different types of reports. In villages, anyway, you don't have a printer to print a 3-page report with images and so on. But definitely what you need to do is when you screen 100 people, you want to pick that 5 to 10 people who need to be brought to a hospital for a full diagnosis, right? So it's a triaging, automatic triaging, where only red, yellow, green is given per person. So this, by reducing the output to what is needed at that place and taking out any expertise in the in the whole pipeline and taking on all of that in the software, itself, making the software smarter, I think we have, made it really possible. The other thing is also the age group, because earlier only above 45 one could do. Now we can make it work on like 18 to 80 years, right? As well as men who can do. So there also there's a universality that we have brought in. And so on the whole, the part which you raised, right, the shyness of disrobing in front of others, and I briefly talked about it earlier, by making it so simple that, they just can do this test without nobody seeing, has also made a huge difference. And one last point is will rural people really like it? I tell you, when I myself have gone to many camps, we have done so many screening camps, 5,000 plus screening camps, and women are waiting to talk about their problems. And breast is a taboo word. I mean, I just say, you can talk about hand, so many places, even educated women, when I say using machine learning for detecting breast cancer as a title, they remove the breast. It's for cancer. Why? I mean, it's just yet another body part. So we talk openly about awareness of what kind of, symptoms they need to look for, and when they have to tell the, community healthcare worker and so on and so forth. And so in this case, they basically feel so happy. And I've had so many elderly women come and almost touch my feet because I really wanted to talk to somebody about this. So there is no taboo. Taboo is only when they feel shy, they don't know whom to go and talk about it, because everybody has problems. I mean, because 1 in 25 women can have an abnormality in India, breast abnormality. So that is what it is. So basically you have to make it simple for them to express their, the shyness, express their discomfort, right? So I think that we are able to do. Sorry, long answer.
No, fantastic, fantastic, wonderful. Thank you so much for that. The next question, actually, I'm going to keep it open for anyone to jump in, but it's something which bothers me personally. We are living in a academia would call it as Industrial Revolution 4.0. They'll call it the VUCA world. You'll read articles about the tuna world, and they'll talk about the larger impermanence of technology and the disruption which is due every few years. So I'm hoping and assuming that whatever technologies you've used, in a few years, they'll be redundant. So does that bother you? And if yes, how are you doing a scenario planning and ensuring yourself from the risk of operating a redundant technology in the next 5 years? I mean, anyone can answer this question, but yeah, look forward to the views.
Okay, I can go first. So basically, personally, I've been in innovation and research for the last 25, 30 years. So if you said that first line, does it sort of bother you? I mean, I felt very excited to see such a world where everything is changing, really, because you have to keep thinking on your foot and then try to do that. As a business as well, one of the core strengths of Niramai is the innovation. We have like 17 international patents and so on, granted and so on. And I also believe that, especially technology is changing so heavily that you should be able to unlearn and learn new things. And the same way the company has to be, flexible and resilient, to adapt to changes. Just give one example. COVID struck, and all of us were like wondering what to do and so on and so forth. And obviously people were not going to the hospital, so people were not taking breast cancer screening in hospitals. So overnight we did two things. We said, okay, we are experts in thermal imaging, right? So how can we use that expertise for attacking the COVID thing? So we within 2 weeks we developed a new prototype or a product, which is now a product called Fever Test, which can be placed at the entrances of buildings, and whoever is coming by, right? It's like a CCTV. It just watches the temperature, it watches the respiratory rate completely automatically using computer vision techniques, and that could be developed because the core aspect of the technology will remain. It's about what else you need to sort of add on to actually keep up with the pace. And then this product is, and similarly, we launched the home screening, which is a business kind of, innovation that we did during COVID. And now we've actually saved 4 lives already in the last 5 months by enabling home screening for breast cancer screening, first time ever in the world, right? So I think the company definitely needs to have innovation in the sort of the blood, if you will, and and that's mandatory actually, be it any business we're talking about.
So if I can take Ankit, I don't think worried about technology because the core use cases are not going to change. People access healthcare for multiple reasons, from being acute, which is hospitals, to preventive and curative, and then of course the dream of Vishal that everybody should be healthy and live 100 years plus. So while I may disagree with a lot of his comments, I will take it offline and talk to him about it. But on healthcare and his view on that, when we are trying to solve this, technology is going to be there to enable this. So we have such a huge population today. I think we have not even scraped a portion of it, because the way we need to provide healthcare, even if you have to achieve the SDG goals of 2025 or 2030, I think there's enough and more more people, more mfines to come and more people to come. Maybe we are approaching the problem from a place of treating people first and then making them healthy. And maybe Vishal is approaching the problem from wellness to illness. And then nobody has read the PMJ document properly, because it has equal and more emphasis on wellness for people who are standing and not lying on the bed. While everybody is discussing that how government is going to pay rupees 5 lakhs for people who are going to lie on the bed, but nobody is talking about the 150,000 wellness centers which the government of India has created, and the digital transformation government of India is doing. Apart, I had the privilege of working in my earlier avatar with Dr. Krishna Reddy, who drives Access Digital. So there's huge work to be done. So technology changing in terms of Python coming to some other thing could be a change, but in terms of use cases, in terms of it's going to be more easier for people to, it will become more dumber. That's what I believe. So not worried at all. So at least I'm 54, so I'm not worried for next 15 years for sure.
So I think the only one point I want to add here is that while technology is definitely going to adopt and change and evolve, I think the bigger problem in healthcare is the conflict of interest in the business models, and which is what creates the problem, not the technology. Just think about it, right? You can today open your Zomato app and order the most freshest pizza and food, and it'll be delivered in 10 minutes to you. But getting an ambulance, getting oxygen, getting remdesivir or some basic medicine is a problem. So the problem really stems on not the technology not being there. I mean, technology has been there for ages and it'll keep evolving and getting better. The challenge is the business model. And as long as there will be, business models which profit from sickness, which have inherent conflicts and trust issues. We did a survey about 3 years back, and we asked people that how much do you trust healthcare? The 96% people or 94% said they don't trust healthcare. In fact, I think after COVID, 99% people will say they don't have the trust in the healthcare systems. And that's the fundamental problem. Everybody here, wants second opinion, then third opinion. And, nobody has a trust in insurance companies and pharma companies. There is WHO says one thing today, other thing tomorrow, it is a complete mess. So I would say that technology will evolve and get better. And I just want everybody to, if you have not already, to watch, two different shows. One is on Netflix called Black Mirror, and the other one is on Amazon Prime called Upload. upload actually is quite interesting. It eventually talks about we all being able to upload our memories and intellect online, and we all live forever on virtual worlds. So, we could continue this, but of course that's a different challenge altogether. And we know Elon Musk is already working on backing up our memories on and making mice play video games. So it's going to be a fascinating future. We never know. But one thing I know, that till we don't sort the conflict of interest in healthcare, it will never be able to serve the ultimate beneficiary.
But I think that's a fantastic point, because that contradiction, and call it predicament or the irony of business models, needs to be aligned at a purpose, vision, and a value level sometimes. Because while you might be adding a certain kind of a value to your customers, there is somebody else who is going in the other direction. And that's the example I think you gave. I think Vishwanath has something.
Yeah,
Yes, you have a good point.
I have a point here, because this conflict of interest discussion is something which I've been arguing with many people while Nicola is waiting. I'll just finish this point. See, end of the day, this conflict of interest, saying that there's a problem with an Indian psyche of being socially, collectively, and capitalist at individual level. So we want the two sectors, education and health. We somehow believe it is the government has to do. And somebody else has to do, and should do out, and that guy should do not for profit. That's an expectation. While I don't mind as a chartered accountant driving a Mercedes, driving into a hospital, but if I see the doctor in a Mercedes car, then I say, oh, ye maise paise bana raha hai. But he has also one life. He will live the 70 or 90 or 100 years. He was a class topper. He studied better than me. I was a backbencher, but I expect him, he should come in an Alto and treat me, but I should go in a Mercedes and see him. And then we talk about conflict of interest. We don't compensate our doctors right. And there's a fundamental problem in the way we do this education. How do we compensate them? And then we create this conflict of interest. So this is a larger discussion, not for this forum, but I'll leave it at that.
Thank you. Thank you.
I have a very strong view on this.
No, I agree. It's a fantastic larger discussion, and I think both viewpoints have their own individual merits, and they're more solid. And it's very difficult to say that we can compete. But thank you for saying that, because the spectrum of viewpoint has to be broad enough for our people to see that there is this end of business and then there is this end of business, and both are running their shows with extreme authenticity and extreme amount of integrity. So thank you for that. Nicola, I'm going to come to you. This has been a whirlpool of a discussion, but I'm going to ask you a specific question. Does the upgradation of technology bothers you? How do you cope up with the advancement of technologies? Nicola. Nicola, there? While he comes back and he joins us back, Dr. Ramachandran, your remarks on the transientness of technology.
Not much to say. It's pretty much inevitable. You just have to deal with it. And from a typical, let's say, commercial or a business, it's always a challenge as it advances rapidly. But from a community perspective, as we come from an open source community perspective for the larger good, it just goes along by itself. Whenever technology advances, the community advances by itself, because it's a contributory effort by not one person or not one entity, but by 40, 100, 200,000, and automatically the community upgrades itself. That is one big advantage of working in a non-IP service-based mode, so to speak. I'm not saying any other business model is not right. Everything is right. But the ease with which technology upgradation happens, the crowdsourcing sort of model, invariably makes this cycle of technology much easier to manage. Invariably, if it is managed well, or if it is dynamic enough. They're very simple. Fantastic.
Actually. Fantastic. Now I'm going to change the discussion a bit. We've got some young minds in this forum, and they're listening to us. Some of them, and one of the needs which have been highlighted by people is this need for purpose and the need for a sense of higher meaning in their work. And this is just the place. This is exactly what people would want to do. So when you look at organizations and building organizations which are built largely on people, what are some of the essential skills you think are going to be relevant for your own typical business models? That's my question. And anyone can start and say, what do you hire for? What kind of skills should people have if they want to do well in the digital world, business models which are run by digital strategy, and in the healthcare sector? Go for it.
Let me start that one, because it's very close to my heart. I started out as a doctor, practiced for about 8 years, and then went into IT at a programming level. I didn't come in as a functional consultant. So over the last 20 years, I've been 25 years in IT. I've come up the hard way from a junior programmer upwards. And therefore, the knowledge of the domain and the knowledge of the technology resides in the same head, so to speak. To young people looking out, I think this is a key message that they really need to understand. You have to learn both domains. And within this group of ours, there are people who have crossed over from technology and have 25 years in the domain. And people like me who have crossed over from the domain and 25 years in technology. That attitude of openness, that attitude of flexibility, that attitude of dynamism is most critical in this industry, almost more than anywhere else. There has to be that flexibility. And then the second major criteria or major characteristic to succeed, or what I would call to really gain satisfaction, is the passion and the commitment that Vishal, for example, shows in trying to make people healthy and live for 100 years. That determination, passion, that life committing attitude is very important in healthcare in general, and digital healthcare all the more, because extremely challenging. There are two different worlds, two different languages. Trying to get these two different industries to talk to each other is a nightmare. You face more failures than successes, and you have to have the sheer willpower and determination to stay the course. So skill sets and commitment, this is a long journey. This is not a short journey. This is not something you can make quick money in. It will take you 20 years to get a point where you gain some degree of satisfaction. And this is a marathon. It's not a sprint. This is a very, very important message I'd like to send out.
Wonderful. Thank you, Doctor. Anyone like to take it up? Vishal, maybe you'd like to say something?
So I think in general, right, I talk about three things with anybody who wants to make a career in any company, and specifically in healthcare, is I think the intent needs to be very, very pure and clear, especially in healthcare, right? Because seva or service should be your primary. If you are not having the intent of service, then you should do something else. You just can't fake it, right? You have
absolutely
to be authentic,
Totally.
So if you don't have, and there are 1,000 other professions to do, right? Where, you can drive a Mercedes, and I'm not saying that there's anything wrong in driving a Mercedes, but I'm just saying that healthcare is a noble profession. And it even talks about in the doctor's own pledge of allegiance, right? It talks that it's a noble profession. It's about service. So practicing what you preach is extremely important, especially for Goki, right? Like I can't be telling the whole world, be healthy, exercise and eat well. And you will see me only eating burgers and pizzas and, slouching in a couch. So being authentic is very important, which is why it's interesting, when in the survey where people said they don't trust doctors and hospitals, the number one person they trust in healthcare, by the way, is Baba Ramdev. And, again, while we can challenge authenticity, but you only see Baba Ramdev doing yoga and talking about good health 24/7 on television. The second person was Akshay Kumar. And that's why we went and got Akshay Kumar on board, because he stands for somebody who genuinely believes in good health. So I'm just saying you can't fake it. That's one.
Fantastic.
The second most important thing when it comes to is that you need to not be doing this with a short-term vision. This is again a long-term. It takes time, right? And in this case, there is no shortcuts also, because it's a matter of people's life and death. Unlike computer programming and hacking, where maximum you will crash a computer. Here, the equivalent of crashing a computer is maybe killing somebody, right? Which is not what we want to do. So you need to make sure that you are not peddling any kind of nonsense in the name of wellness or Ayurveda or healthcare. And there's a lot of that happening right now, unfortunately, that a lot of spurious products and services and alternate treatments are being given to people, which may or may not be relevant at all. And thirdly, and this again is relevant for all startups, right? I think you need to learn to fail. I think healthcare is even worse because the failure cycle is so high, and your frustrations are very high, right? And because you have to depend on the system a lot of times. So failure is something you need to start living with on a daily basis. So that's really the 3-4 key things. But it's interesting, and I think that the pandemic is going to be the turning point, I believe, for the world as far as healthcare is concerned. You can't have entire populations with diabetes and obesity, right? India is the capital of so many diseases. If it is going to be the capital of so many diseases, no wonder the virus can create so much havoc.
Yeah, fantastic.
Totally agree.
Yeah, I think the point on intent, seva, and service, I think is fantastic. I want to check if Nicola is there, and I'll quickly take his views. And Nicola, would you be there? Are you there? We'll just wait for a few minutes for his response.
I think his network connection is.
He's got it. Yeah. Okay. So Vishwanath, yes. Same question to you. How can people prepare themselves to rock this world?
See, I think when we are doing an mfine, when we build this access and healthcare with Ashutosh, who had founded Mintra and come here, and Prasad, who was multiple entrepreneur and who built this organization. And me, I joined healthcare 5 years back, thinking that I will make a huge difference. Otherwise, I was very happy doing what I was doing with so many other things. I was CFO for Kalyan Jewellers, where people will come to me only when they're happy, right? So it's much easier to sell wedding jewelry than come and work with one when a person is sick.
Yeah.
But the fact is, it's a reality that while we want everybody to be healthy, there are going to be people who are going to be sick. And we need somebody who treats them. Seva, yes, but seva doesn't mean that that person has to be in poverty. That's, I believe, very seriously. And people have to, when you can pay for a burger 600 rupees, I'm sure you can pay for a doctor's consultation and advice 1,000 rupees and not 250 rupees and negotiate with him that I will pay it later. When we are willing to pay a lawyer 10,000 rupees for an hour, P. Chidambaram 1 lakh rupees for a case hearing, I said we should be paying a good surgeon who can do a transplant, a good amount of money to do the transplant because he's saving your life. And I don't think I can put a value for life. So there's this fundamental issues on seva and what you should real compensate. There's a conflict. I understand whether you should make money, you should not make money. That's a different thing. You can be a yogi and ascetic and you don't want to make money, you want to make money, forget. That's all a very different discussion. I don't want to get this individual choices to make. Despite Devi Shetty, he's a celebrity. Is he not a billionaire? The answer is he's a billionaire. He became an entrepreneur to make hospitals. He's doing seva, but people do many things which we don't know. Since I've worked in healthcare, I can tell you there are many founders who treat so many free patients which they don't even tell you. But they don't treat free patients out of their pocket. They take it from some patients who can afford and transfer that money. They do a lot of social costs. They don't come and tell you that they're doing that. Crooks are there in every system. The society is full of crooks, so it's not healthcare. So in these last few days, I've been so overwhelmed that day starts at 5 in the morning till 12, just arranging beds for people across the country, not just in one city or one place. So the whole system is broken, right? We can't treat so many patients. So if there's no remdesivir here today, or if there's no oxygen plants today, because we were not geared for this crap, we can't have so many patients. We have only 2 million beds, which is less than half bed per what is required by WHO requirements. Our capacity should have been 4x of this. We don't have the capacity. I think this is an aberration. I think we'll all learn, we will invest, and we will build. Coming to what should be the passion. So we evaluate that they're passionate about what they're trying to do in really making the difference. and improve them. How do we impact the quality of the people? While we would see over a period of time that how we enable people be less and less on the bed, but be more and more standing. I think that's what we would strive as an organization.
Fantastic, fantastic. Thank you, and more power and more force to you. Hoping and I'm praying that you continue to arrange for beds. It's a wonderful, noble service in itself. Continue to do that. Even though you have to get up 4 o'clock in the morning, I'm hoping that it's gratifying. And you
just now, I was trying to arrange. Just now in this call, I was trying to arrange an ECMO machine for somebody in Hyderabad. So just reached out to 4 hospitals. So that
more power to you, Vishwanath. More power to you.
That keeps going.
Geeta, your closing remarks. We'll close it with you. I'm assuming at some point of time you would want youngsters to join you. You would want the young millennial population to become part of the vision and purpose. And at some point of time, you will hand it over to them. What is your advice to this young crowd? How can they become part of it? Go for it.
I think the previous panelists, did a great job of giving so many characteristics. I will just summarize with a few of them. I think definitely thinking something bigger than yourself. Not thinking about when I'm going to get the next hike, every 6 months, do you give a hike? What percentage? Instead of that, think about, yes, definitely a larger vision of what the Seva part, which he talked about. Seva, again, there's a conflict. I'm not saying you can't ask for a raise. Please ask, you'll get probably the same growth in a healthcare startup compared to any other. Having said that, but if you come in and saying, I want to save lives from breast cancer, it's so much fulfilling. I have been in the industry in Hewlett Packard, Xerox for multi-years, like 25 plus years. And I tell you, the amount of learning I did and the amount of satisfaction I got, even with an innovation-focused job there, versus the last 4 years of serving people through technology, it's amazing. It's 20 times more. Just the satisfaction, when you get a call, you did this home screening and thanks so much. Now I know I need to go. And she calls saying my surgery is done. It's unbelievable. So I think Vishy mentioned, saving lives, you can't put a value on it, right? So I think thinking bigger than yourself when you take up any job is very, very important. Second thing is go with the intent rather than the ticking, we have all of this process. Okay, I have done this. That's not it is. How deeply were you supposed to understand why you're doing that action and go for it? Don't wait for what, your manager has told, or don't limit to only that. Think about the task in the sense of why is this task needed and I'm going to do it. So thinking about any activity with the intent perspective, understanding the intent perspective and doing the activity rather than putting a tick to the activity, right? You can apply it to any local home activity or work activity. So thinking about that, learning something new every day or open. I think one of the previous panelists mentioned being open to feedback, open to learning, and open to unlearning and learning. All of that is absolutely. And then finally, I think if you actually put your heart into the work, the passion aspect is so important that you can go a long way. I think that's what I would say. And there is a huge number of problems around. You can pick any one of them. You can be an entrepreneur as well. And there's a lot of growth possible in health tech itself, and you're in the right era, and go for it.
Thank you so much, each one of you. Before I hand it over to Dipangana or Suzanne, I just want to personally wish all the very best, all the very luck. Dr. Ramchandran, may your think tank grow. May you continue to offer the knowledge which you have. Vishal, someday when you and I turn 100, we'll grab a drink together. That's a dream you and I will continue to share. Yes. I hope that you venture into more complex problems which society needs to be solved, just not breast cancer. You get into many other such similar issues, fight that social taboo and provide whatever you wish for. Nicolette, continue to do the fabulous job. Dentist, in my limited knowledge, is a very complex field, and what additive manufacturing and 3D printing has done for you, I hope that you're able to reach the scale. Vishwanath, mfine is a fabulous platform. The pilots which you're running, I wish that they're successful. Someday when we travel to the tier 2, tier 3 locations, I wish to see mfine on the doors of pharmacies, clinics, and inshallah that shall happen very sometime soon. So to each one of you, I wish you that your visions and your aspirations turn true and soon, and you stay course on track. So on that note, ladies and gentlemen, thank you for this wonderful discussion. I go back very positive. I go back feeling so nice about the day that it ended like this, and more power to you. Dipangana and Suzanne, over to you guys now.
Thank you very much. It was a real pleasure.
Thank you.
Thank you so much, speakers, and thank you, Ankit sir, for moderating such a great session. I'll be just quickly running dozee's video because we missed that before. Just 1 second.
Here's what convinced me about the importance of having dozee as a remote health monitoring device. We had an elderly patient living alone. Her daughter had placed dozee under her mattress so that both she and us could monitor her vitals at the healthcare facility remotely. This one time we got an alert indicating a decrease in her heartbeat levels from the device. When we inquired her regarding that, she just brushed it aside, telling that she was just feeling a little bit tired that day and passed it off as an age-related problem. So we called her in for an additional medical test and found out that she had an abnormal heart rhythm, and ultimately she needed a pacemaker for that. Possibly without dozee, it could have been fatal for her.
Dozee is India's first contactless remote vitals monitor. Its thin sensor sheet, once placed under the mattress, tracks person's heartbeat, respiration, sleep, blood pressure, and even tiny heart valve movements with medical grade accuracy. Once connected, the vitals can be easily monitored on the smartphone app and on a patient monitoring system. A centralized web dashboard where hundreds of patients can be monitored at once. This is how dozee is helping hospitals to monitor the entire ward remotely.
We are able to convert our COVID wards into step-down ICU within hours at a fraction of cost with dozee. It has reduced the workload for both doctor and nurses and also exposure to the infection tremendously. This is because now we are monitoring COVID-19 patients remotely, as dozee can be combined with SpO2 sensor too. The best part is we can customize alert for each patient and take a necessary action when required. This helps a lot in improving our daily workflow. At ESIC hospital, we are able to timely shift patient to ICU based on alerts.
Dozee can be used on any number of patients and with any commercially available mattresses. It requires no maintenance, and it can even be integrated with the hospital's EHR systems through our APIs and SDKs. Dozee has been supported by the Government of India, Bill and Melinda Gates Foundation, and various other organizations. With more and more consultations going online, dozee is helping provide better healthcare outcomes to thousands of patients at home. It is also helping many leading hospitals to create step-down ICUs. Continuous non-invasive monitoring of health vitals will be an integral part of future medicine, and we at dozee are happy to provide it today.
So that was dozee. Thank you, everybody. And now I would like to call upon Dr. BBL Madhukar, Director General, BRICS Chamber of Commerce and Industry, and also the Chairman of Ford School of Management for the closing remarks. Thank you. Sir, your screen is on mute. 1 second, I'll just. Yes, we can.
You can hear me? Can you?
Absolutely, sir, we can hear you now.
Okay, all right. I'm so glad that I'm part of this whole program where we are talking about the role of digitalization in monitoring health economy. I call it health economy because I know that everything revolves around a business model which only works in the current scene of the world. COVID has woken us up to various alternatives for maintaining health for the country. We find that lots of people are unaware of so many innovations in the digital area, and because of that, the health system has not been able to derive that much of benefit as it could have done. I'm so glad that the session led by moderated by Mr. Bipin Babu has so many good participants and speakers who have talked so many important points. So many points have been raised by them, particularly when Mr. Ankit raised the question of inclusive system of healthcare system. Inclusiveness is very important because India has a very large number of people, large population needs healthcare in a big way. And our problem is that about 75% people live in the villages, which are not easily possible to access. At the same time, we have also the problem of internet connectivity, which frustrates any system of digitalization reaching out to the vast mass of people. So this is another handicap. But at the same time, we cannot ignore what Mr. Vishal said regarding the traditional system of treating people in a spiritual behavior modification in life. That is very important segment, because in the time of COVID, when no medicine works, it's only that which is giving some kind of endurance, and that thing is also going to be adopted by the whole world, and because the value of such healthcare principles are being realized now more by more number of countries and people than before. So we are very thankful to both the moderators, Bipin Babu and Ankit Jam, who have been able to bring out all the important facets of digitalization in the healthcare industry. I'm so thankful to all the panelists who have been able to give very nice vision to all of us. And in our futuristic journey, it is necessary that we strengthen the healthcare sector. The rise of digital technology is pushing India to achieve health for all, putting the country at the forefront of foreign investment. With these opportunities, India is emerging as a global leader in the digital health industry. I, on behalf of BRICS CCI, would like to thank everyone for participating in the session, more specifically our associate partners, mfine, dozee, BRICS TV, and hope that the session will contribute in development of digital health market and encourage talented minds to conquer the opportunities and gather a deeper perspective on the practices and possibilities of digital health. I must thank everyone who participated in this whole session, particularly those anchors like Ankita and Suzanne and Deepangana, who have been able to monitor the whole thing. Thanks, everybody. All the best. Thank you.
Thank you so much, sir, and thank you everyone for joining us. With this, we have come to the conclusion. Thank you, guys. Thank you for joining.